Today we will be talking about advanced application of botulinum toxin in aesthetic facial procedures. So I'm Dr. Nabil Faki, craniomaxillofacial surgeon and a facial plastic surgeon with a fellowship in facial plastic surgery and rhinoplasty, owner and medical director of Faki Hospital, European Center for Plastic Surgery, and the vice president of the Spanish Society of Facial Plastic Surgery. So, an expert person who has made all mistakes that can be made in a very narrow field. This is an expert. So that's why it's very important to learn well to put Botox. So as we see, this is the experience of the experts on the TVs. These people are so famous people which are in TVs, and both of them have bad Botox. The first one, they have put here Botox and they did not put here, so she had this effect. And this person has a paralyzed face. These are from Fox News, which when I was seeing the TV and said, oh, no way that these people have these bad Botox done. So learning Botox is like this. If I ask you what are these two colors, maybe a lot of you will be telling me, oh, these are different colors. The first one is gray, the second one is white. But if I close only the center of this image, both would be gray. And why is this? This is because it's illusion. And when one is learning from another one to put Botox without taking care to all important points, he will be illusioned by some of the aspects of putting Botox. So how did it started everything? In fact, from a fatal disease to a biological weapon by the US Secret Service, they tried this to use botulinum toxin. But the first one who have described it, Dr. Emile Pierre Marie van Emmergen, was first case of botulism in 1895, and he identified that the caused agent was called Clostridium botulinum. It was an anaerobic spore forming, very sensitive to heat and resistance to OH. There was 7 stereotype. Resistant to OH is resistant to alcohol. 7 stereotypes: A, B, C1, D, E, F, and G. Only type A and B and E affected humans. So, what happened with this bacteria? As you have seen in 1895, Clostridium botulinum, the bacterium that produced the botulinum toxin, is isolated and identified. In 1920, Botox was first discovered when Dr. Kerner was researching the cause of death of a German who had consumed sausage. So he said, oh, that's the Clostridium. In 1928, botulinum toxin is purified for the first time. And in 1950, research discovered that the injecting overactive muscles with botulinum toxin resulted in decreased muscle activity. Was in 1950. In 1960, botulinum toxin preparation standardized for therapeutic purpose. So it's like 60 years ago. In fact, from the 2000, which they standardized it, and now we are like in these new 20s. It's about 80 years from today, around exact. It's not the exact. So this is when they start standardizing it. In 1973, botulinum toxin type A used in monkey experiments, and they started using it. And this botulinum toxin A first used that treat crossed eyes, strabismus, and uncontrollable blinking like blepharoplasm. In 1989, the FDA approves Botox A, now called Botox on that, for the treatment of cross-eyed, uncontrollable blinking and hemifacial spasm. In 1993, the Botox toxin proven useful for the treatment of achalasia and spasm of lower esophagus. In 2002, the FDA approved the use of Botox for foreign lines between the eyebrow, which are the glabella lines only in 2002. In 2004, Botox granted approval in the US to treat severe underarm sweating. So it's not so far from here. In 2010, Botox received FDA approved for treatment of chronic migraines. So as you see, we don't have anything except these which are approved. And now on they are trying to FDA approve more other things. It's very important to know that Allergan in 1989, bought by Dr. Scott Company, which was called before Oculunum Inc. Botox, was uh, he bought it and he made Allergan. But till 2003, the FDA approved the first indication for aesthetic medicine. In fact, it was the final of 2002, but legally it was approved in 2003. So Botox by numbers, well, in fact, it's the top cosmetic minimally invasive procedure done worldwide, and it costs about 1.9 billion dollars a year. But do you know that with 1.9 billion dollars, what you can do? You can take out hunger of all this kind of all these world. It's a lot of money spent on Botox. The average age is between 40 and 59 years old, and it takes around 15 minutes. Remember that to tell your patient that average treatment lasts between 3 to 5, 6 months, depending on how much you absorb Botox and the muscles moves in. So I usually tell them that it's around 3 to 4 months. Because if you tell them that it's around 6 months, they will come back and tell you, oh, my Botox went out. And they will not come back again to you. So also Allergan has 90 patents, and the average cost of the procedure is around $380. Depending in your country, how much does it cost? The Botox, but it's around every box of 100 units costs around $200. So you can have a profit how much you want to have, so you could go more in or just leave it less and gain more. So by having more patients, I mean. As you could know, the face has 43 muscles, and not all muscles are treated by Botox, and only FDA approved for special things only for glabellar area in cosmetic search in cosmetic medicine till now. So there's a lot of misconceptions about Botox. I hear patient telling, "Oh, one day they put me Botox and my eye went to the left." Uh, does the patient can develop addiction to Botox? No. Botox injections are highly toxic. This is no. Botox injections distort a facial expression. Well, in fact, they does not distort the facial expression. They try to change in a way that the face seems more relaxed. Also, Botox injection can cure depression. In fact, there are studies, they do not cure depression, they make you feel better. So, feeling better makes you not having the symptoms of like a lot of depression. Also, Botox injection cause headaches. I've heard this. And why when they inject me Botox, I have headaches? In fact, it's not headaches. Sometimes this abnormal movement of not moving your muscles is weird for people who start putting Botox. That's why when you wanna put Botox for people who it's the first time, try to inject lower dose and tell them that I will start by lower dose, and when you get used to this, we can go for more. So, as you may know, the botulinum toxic has a single chain of 150 kDa. So it's a cleave to form a D chain molecule with disulfide bridge. One is 50 kDa light chain and the other is 100 kDa heavy chain. So, as you know, the light chain acts as a zinc endopeptide similar to the tetanus toxin. This zinc-dependent protein is responsible for the intracellular separation of the SNRE protein required for transmission of acetylene through the peripheral neuromuscular junction, reducing the chemical denervation. So as you know that we have a light chain, a heavy chain, the green one, and the heavy chain contains the C-terminal, provides cholinergic specificity and binding to the toxin to the presynaptic receptor responsible for binding to the presynaptic nerve membrane. So it's very important that you know that uh, all brands have different light chain and have different heavy chains. And that's why they are trying to, every brand trying to study on these chains to improve their Botox. So the sprouting phenomenon is very important. So in fact, when there is acetylcholine released to the synapses, so when we inject Botox, you should know that the Botox goes in the nerve ending. This is the acetylcholine, which is moving to give a stimulation. So the Botox goes in and it unites to the acetylcholine, as you could see in this image. So it internalizes the Botox. So when it comes, this acetylcholine wants to work on the synapses. It will be stopped by the Botox, so will be no contraction and they will be blocked. So after the chemical denervation, in 48 hours it appears demyelinated nerve neoformation outside the UNM sprouts. So as you could know, start formation it's about 48 to 72 hours. So it's very important to tell them that you will not get the result today, like fillers. You will go home and it will start about 3 to 3 days, and full formation is about 3 months. So I could say that there is a maximum level of Botox, which is around 2 weeks, which the patient should come back to your consultation and you have to check him because this is the maximum active Botox. And it will start going by days less and less and less till you lost all the Botox effect. So it takes effect by 3 days, will maximize by 3 weeks, and will last about 3 months. This is like if you should learn something 3 3 3, but in fact it's around 2 3 days, 2 3 weeks, and around 3 4 months. There is the study of this sport where shrinking similar to Botox is that the average onset time of effect was 3 days and the mean duration was 90 days. Published in 2009 by Moy R. So this is a nice picture of a patient from online, which you could see before how it was, after 7 days, after 14 days. So this means that it takes around 2 weeks to give a maximum. This area you can improve it by some fears too. That's why you should detect this and tell the patient before you do any treatment, because he can come there, oh, this is didn't gone. As you see in before 70 there is still a contraction. After 14 days there is no contraction. Here again, as you could see, it's around before, after 7 days, after 90 days, after 120 days starts again. That's very nice one. So the mechanism of action, we have who acts on the synap25, who acts on the V snare, who acts in the syntaxin 1A, and depends on which type of Botox. A, CE is the first, which are the one which could act on man. The B, D, F, G also, as we can have the neuroblock, and the syntaxin, which is on actin C, we don't have anyone in the market. So toxin in the market, I should say that this image is for Spain, and as you could see, the Vistavel and Botox are for Argan, and they work they are on ontobotuxylin A toxin, and the units is Botox units. We have the other thing, which is Elazur and Sport. We have the abotulitic A toxin, which have spyward units. It's very important, the units, they are different. Bocotur and Chomin, which are from Merz, also have work on oncotubulating A toxin, and they have DL50 units. And the other is Neuroblock and Myoblock, which has work on Rima botulinum B toxin, and they have standard units. So Vistavel, we could have it from 50 units. Botox, we could have 120 units. Alazur it's 125 units. Dysport we have also from 500 units. In Cobalto we have 50 units and 100 units, and Chromium we have 50 units and 100 units, and the others we have 5,000 units and 2,500 and 10,000. These are more for neurology. These are more for cosmetic. So also it's very important that in Spain, Vistabel is only accepted by country to be treated for aesthetic, whereas Botox, which is the same brand, same, but this is like legal stuff. It's only Botox used in hospitals. In the United States, Botox could be used in 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 cosmetic offices and cosmetic centers. In Lebanon too. So it depends the country. But as you see, this is done by Allergan. Alazur by Galaderma, Dysport by Epson Pharma, Bocotur by Merz, Chemin by Merz, Neuroblock by SI. So as you could see also, which we have different chains, the light chain and the heavy chain. As you see that Allergan uses 150, 750. As you see, Alazur and Dysport uses 150 and 350. And as you see, Merz only use light chains, saying that if we take out heavy chains, we have less radicals and the Botox will act differently. So let's go for things which are for beauty. I could put I should use between not Vistabel. I should use Botox for international people who are hearing us. So Vistavel and Botox are the same, are from Allergen. So you could use these. And normally I don't buy 50 units in my consultation, since with 50 units you do not do a full rejuvenation treatment Botox. You need around 60 to 75 units for every patient. So if you want to treat exactly everything you should like to treat in a basic mode, you need, and if you need a full face treatment, you need like 100 units for every patient. So normally I try to charge uh, like 300 $350, depending if I want to use the 75 units and leave 25 units from this patient, or want to use all the box. So let's go for storage, transport, mixation, and indication. As you see, Allergan Botox should be stored between 2 to 8 degrees when it's open. If it's not open, you can put it in freezer. Whereas this port and Alazur should be also the same in refrigerator between 2 to 8 centigrade. Where Bocotur and Chumin, no need for refrigerator. I can open it, I can leave it outside, but we try to leave it always in the refrigerator. But I can transport it. No need for transportation in anything except normal temperature below 25 centigrade. And neuroblock and botulinum toxin type B, myoblock, it needs refrigerator. So what is good? This for countries who doesn't have constant electricity, or for people who would like to travel with a Botox to treat a family member, or for if you work in two different centers and you use your own Botox and you want to transport it without any refrigerator, the recommended is using Merz, which no need for refrigerator. So as you could see, the duration also is very important. It 24 months of when they do the Botox, the effect will stay in the bottle, where Merz has a 48 months, like 2 years. Also remember that when we mix this Botox, we should mix it with saline. Remember, with saline, it's 0.9% saline. There are some which are the Neuroblock and the Myoblock, need prefabricated solution. Also, as you see, the indication is for blepharoplasm, torticollis spasm, hemifascial spasticity, aesthetic medicine, and the others are for aesthetic medicine. Also, this is for aesthetic medicine. It's not for aesthetic medicine. And when I say aesthetic medicine, it's only for glabellar. Till now, it's only FDA approved. The other parts of the face, it's not FDA approved. So whenever you do Botox, you should tell the patient, and the consent should be written. You don't know when there is a patient who comes and he is like a lawyer or whatever and want to be go crazy with you, and he can tell you this is not indicated. So when you get the bottle for the first time, you say, "Oh, there is nothing in the bottle." In fact, after you open it, you should leave it for 10 days, I say, 2 weeks sometimes. You can leave it in the refrigerator and it will not lose the good effect. So as you see, always use the same dilution to learn. Always use the same brand or two brands and be constant in learning with them. So Botox and Vistabel, the bottle should suck the needle content. When you put saline, 2.5 milliliters of saline in a 100 unit of Botox, when you inject it in the bottle, the saline will go automatically in since it is in negative pressure. Use 4 to 6 hours after reconstitution. So how it's very important. I see doctors who get their patient in the consultation and they put saline in the buttocks and they want to inject it. This is an error because you will not get a good dilution. So when I reach every day at the morning, I let my nurse, I put only Botox in the afternoon treatment. So in the morning, I let my nurse to prepare me one bottle of Botox. Depending on the patient, let's say that I have 4 patients today, just I calculate maybe I need 2 to 3 bottles, I prepare 2 to 3 bottles. So I prepare them in the morning and wait for 4 to 6 hours and then I use them. So I have a good dilution in the bottle because this is a powder in the Botox, so it needs time to dilute. So it's important for different units to differentiate that all different units are different. Like Alazur has different units from Botox, so you have to dilute with another type, and Bocotur or Mertz ones have the same dilution as Botox and Vistabel. The only difference is Alazur. So 1 unit of Botox or Mertz one, it's about 2.5 units of Alazur. So Azalur, it's totally different in dilution or the sport than Botox. It's 1 to 2.5. I only use Botox and I will let you know why after that. So norms of reconstitution is very important. Use saline 0.9 at 4 to 8 cc. It's very important to leave your saline in the refrigerator. Insert the needle into the via at a 45 angles. Keep the needle out of reconstitution liquid to avoid bubbling, which is very important. Do not shake dilution. Do not shake it. Just move it circularly. Do not, after dilution, do not freeze. Do not freeze. Never freeze it. It's in the refrigerator, not in the freezer. Use 1821 needle to use to extract the content of the wire into the syringe, and then you put a 30 gauge needle used to inject. I have shifted, and if you follow my social media, you would like to see that I'm not using a 30 gauge. I'm using a 33 plus, which is around 34 gauge. It's the box called Invisible Needle. The company is TSK. You could search it on the internet. TSK company, which has the invisible needles, which I inject Botox with a lot less pain. So what's the mix? So let's say that we're working with Botox of 100 units and Botox of 50 units. I take out the cap of the Botox. I inject the saline. How much saline? I take saline 2.5 milliliter. These 2.5 milliliter I injected in 100 units. If it's 50 units, I take 1.5 milliliter of saline and leave it the half the amount. Since this is 100, this is 50, I put 1.5 milliliter in this Botox, and by this I could have, since I put 1.5 milliliter, I would have one syringe of 1 milliliter and 0.25. In this, I would have one syringe of 1 milliliter, another syringe of 1 milliliter, and a 0.5 syringe, since I put it 2.5. So I will be having 2.5 syringe of 1 milliliter. Here I will be having 1.25 syringe milliliters. So remember to just move it like this. Do not shake it. Do not shake it like this. Move it like this. And let's start. So I just like to reassure what we have done. We have 100 units Botox. I only use 100 since 50 is like you cannot use for a full face. I don't buy 50 units. So I get 2.5 saline. This is a 10C maybe or a 5cc or whatever. You put 2.5 cc's of saline, which is 2.5 milliliters, in the bottle of 100 units. I move it in a circular mode, and what I will have 4 injections or 2 injections, depends how much cc's. If you're having 1 cc syringe, you will be having 1, 2.5, since I put it 2.5 cc's. There is no liquid in here. There is powder in here. So what happens when you don't take out this? This is a trick. I always take it out so I could take everything in the bottle. Since if you don't take this out and you flip it, you will lose some units of Botox here. You cannot take it out with the syringe. So I open it always with a Coca-Cola open. So I know there is a lot of Botox party, and this is like a timeout. I've seen people telling me that, oh, we have a Botox party at the house of a hairdresser which does Botox parties. These are things that became so normally a few years ago. So diffusion. I don't use this sports, although there are surgeons who love this sports a lot because it's more diffusion, and you can have a more effect on the patient. Some patients more happier, but you can get more complication in diffusion, maybe, or you didn't want to treat it like this. So this is a pilot study comparing the diffusion of two formulation of Botox and Dysport. And you could see the identical injection volumes you could have with Dysport, a greater diffusion and more potential for adverse effects, which we'll talk later. That's why I use only Botox. It's so selective. This is a day which I can start. I've been prepared a lot of injections in a day which I have a lot of patients with Botox. So you have to prepare them and reconstitute them and leave them in the refrigerator. And as you could see, I leave some units of Botox for every patient with its names on, so I could know that for in 2 weeks I should see them again. Muscle contraction. All muscle has an origin and an insertion, and the vector of muscles contraction goes from origin to insertion. So when you want to inject Botox, you should know how the muscle works so you could exactly understand why this is the Botox working like that. Also, it's very important to understand that there is muscle classifications, which there is kinetic. The facial muscles move according to emotion of expressions you wish to convey, and these kinetics movements makes wrinkles. But also there are some wrinkles which are static wrinkles, and these static wrinkles you need fillers to improve them. That's why how we can differentiate between static movement and static wrinkles and non-static wrinkles. The non-static wrinkles, which it's alone and passive when you're seeing a person without moving his face needs fillers to improve them. Why movement wrinkles of muscles needs Botox to release this, and the muscle will not work. So hyperkinetic also, there's some muscles which contract a lot and faster and make pain, and hypertonic have difficulty in relaxing these muscles and make a lot more pain, as the masseteris and ATM dysfunction. Dynamic and static wrinkles, which I was saying before, it's very important to understand these, and some are done by sun, which is the first enemy of all beauty, women's and men's who want to be they're 60 years old with less wrinkles. So don't get in this problem with the patient. Always explain him there is static, dynamic, and static. So by this he would understand why you need fillers in treating some static ones. So these are the muscles, how they contract, and it's very important you see how the wrinkles are perpendicular to the direction of contraction. So if the muscle frontalis muscle goes up, the wrinkles will be like this, as you see. If the muscle goes in an away like this, you would have like this. So it's very important to understand that muscle contraction goes perpendicular to the wrinkles. So apply specific Botox protocol always to avoid problems. First, ask medical history. If he has allergy, risks, contraindication, he takes aspirin, you may have more bruising. It's a very important question. Immune problems, previous drug treatments, or did he did Botox before? Yes, so he knows what's the movement, will happen to him. Ask him something which is very important, and I have seen a lot of doctors not asking it. Are you allergic to albumin, which is eggs? Why? Since some type of Botox has albumin, and if there is someone allergic to albumin, he may have a risk of, as you could know, a shock. So, also see wrinkles, wear scars. Try to let the patient understand between dynamic and static. Third, explain the treatment, their safety, their effective, the limitation, the contraindication, expected benefits, and potential needs for adjustment. Always let the patient knows all these questions. Third, accept the budget. Since why? I've got some patients, they know that my Botox is priced like this, but after you put them, they try to get discounts. They try to, oh, there is another doctor doing this in that price. No, no. My budget for putting Botox is this. And do you have this budget? Yes. And this is the price of the Botox. Never agree on obliged results, because patients sometimes come with some results they have in mind, and always sign the informed consent. Always. I know a lot of Arabic countries, they don't use informed consent, and it's a great mistake. Always take pictures before and after. Since 1 month ago, I had a patient which she had a bone reabsorption in one area, which is she born with this, and I put Botox on her, and she came telling me that the left side is bigger than the right side, the bone, and I made this by Botox. This is incorrect. I have taken pictures before of her and let him see that she had that before. So, next step is that discuss everything with your patient, and when you discuss with your patient, you should explain him everything. Contraindications. One of them, which is very important, is neuromuscular diseases such as myasthenia gravis, multiple sclerosis. The second one is infection in the injection zone, hypersensitivity to albumin, remember that, pregnancy, okay, lactation, excision via breast milk, drug treatment, and that may enhance the Botox, like aminoglycides, penicillin, magnesium, sulfate, quinine, channel blockers, or calcium. Psychological unstable and unrealistic patient, avoid these all. So it's very important to take into consideration that also before you inject, one should not take aspirin, ibuprofen, St. George's wort, omega-3, vitamin E, ginger, ginkgo biloba, and ginseng. All these makes a lot bruising and bleeding. So there is some resistance to chemodenervation. It depends on dose, type, time dependent. It happens in 3 to 5% of patients. And to prevent it, do not use more than 100 units per session. Extend to at least 3 months the following dose. I have seen patients who come every 2 months. Okay, I have money, just put me more Botox. I don't want to leave him to wait 3 months. And if you need high dose or frequent intervals, alternate the type of toxin. It's very important to know anatomy, to know muscles, to know how much the muscle is far from the skin. And this, it's the only way to learn this is by going to courses and to dissect and know exactly how far is the muscle from the skin. So how far is when I inject, I should go with the needle. Also, it's very important, and we'll see it later, about the Dow muscle. As you could see, the Dow muscle is the muscle in this area which let the corner of the mouth go down. If I inject Botox in this area, I will release this muscle from giving attention in an inferior tension, and the corner of the mouth will elevate and have a nice smiley face. If you make an error and you inject in here, you will let this lip go down and you have a facial paralysis of the nerve. Since the muscle doesn't work, and it's the same effect as if he had a facial paralysis of the marginalis nerve. It's very important to use needles. I use the TSK invisible needle. This is the old ones, but now I'm using the invisible needle, which is a 34 gauge, and I prefer to use that. If anyone wants a picture of the invisible needle, he can follow my social media or write me an email and send him an image of the box, and he can search for the box, or go to TSK website and search for invisible needle. So the injection technique, clean the treated areas with distilled water. Do not use alcohol. I have seen doctors use that. This sterilizes the Botox and would not work the same. Apply IMLA or ice 20 minutes before if you'd like. In fact, I never apply IMLA. I just use a vibrator, which the patient holds it and put it in his face, and he will be distracted by this vibrator. And by using the 34 gauge invisible needle, which is called like that, he will have less pain. Inject the skin in 35-45 degrees. It's less painful than vertical one and more effective because it takes more muscle fibers and less degree of subperiosteal dissemination. It's very important to note two things in Botox. If you inject into the muscle, you will paralyze the muscle. If you inject subcutaneous, there is some Botox will reach by dissemination to the muscle, and the muscle will get a relaxed effect. There are some muscles which we want to paralyze, and there are some muscles which we want to relax. It's very important to separate these two things. So possible treatments are all these, which I can treat platysma band, dimple chin, gummy smile, bunny lines, lid lines, frown lines, forehead lines, eyebrow shaping, crow's feet, nose elevation, lip lines, and marionette line set smile. All these could be possible treatments for Botox, and we'll be learning every one of them. It's very important to understand that only they are for front lines indication as a legal indication. And these are all the muscles which we treat to improve. So you could know that there are people who tell you that Botox is only used for the first third of the face, where there is a lot of treatments also for the inferior two-thirds of the face. And that's why it's very important to understand and learn how to do them. Mainly for aesthetic purpose, we do the green ones. It's very important to understand the effect of brow. So brow, we can have elevation, and brow opposers will make the brow goes for the center, and brow depressors will make the brow go downwards. So the anatomy of the first third superiorly, we have the mobility of the forehead and the mobility of the eyebrows, which are done by the frontal muscle, the red one, the corrugator muscle, the blue one, the procerus muscle, the yellow one, and the orbicularis muscle, the pink one. Let's go for glabella area. The corrugator muscle, there are two, one on the right and one on the left. And you could see that we could have like this image or like this image as image A or image B. And this is how we know that, by letting the patient frown and draw where are these muscles reaching. Okay, so as you could see, the function is approaches eyebrows, and they are responsible for oblique and vertical lines. Second muscle is the procerus muscle. It's unique in the midline. As you could see, it depresses the eyebrows, and it's responsible for horizontal wrinkles in this area. As you could see, the relationship between the corrugator and the procerus. And whenever you put procerus, put the corrugator, and whenever you put the corrugator, put the procerus to improve this area. So it's very important to know this is an insulin needle. Just for people who use insulin, I don't use any more insulin. I use invisible needles, which is the 34 gauge, 33 plus. You would see in my presentation the green one, which I inject like around 1 to 2 millimeters. The yellow one, which is about to 6 millimeters, and the red one, which is about to 8-9 millimeters. So whenever I put you a green color that is superficial, yellow is half mid, and red is so deep in the muscle over the periosteum a bit, so as you see in the image. So let's start. Let's treat the glabellar areas, and I will be explaining how it's done by books and how I do the technique, which is more selective one and with better, is how you should learn. But I should explain what they tell you and what I do, so you could know, understand why I do this and not that. So first, you can put in here in the middle to to to, to put for the procerus. Sometimes you could go more in here down. For the corrugator, you can put one here for this muscle, and one here, and one here, and one here. And for the upper one, for the part of the corrugator, the last part, you could go for a yellow one. They use 4 units. These are powerful muscles, and we need 4 units of Botox. Remember that you could put also less units, and depending how much the patient have contraction. Also, you should see where are the frontal area. So the frontal area we could have a one belly or two bellies. So do not inject Botox in here since she doesn't have any muscular contraction. In this patient, yes, he has all the belly. And it's very important to know exactly where the muscle finishes in people who are bald, since sometimes you inject in here and you leave this contracting and the patient comes, oh, I have these movements in here. So the frontal area, as you could see, in books they say that to treat the frontal area, draw from the pupil and draw from the other line of the pupil and just put Botox in here and do not put Botox here. So if you do this, you will have this effect. This is an error. I know a lot of doctors using this technique, just putting Botox in between pupils and having these problems. This is called Mephisto sign. The patient should come to your office. You have to inject him more Botox in here and more Botox here to release it, and it will be solved. Why you have to do this error? Because you're not updating yourself, and Botox is not done between the two pupils anymore. So I will be teaching you later. So to treat Mephisto of another surgeon who did this, you could inject in here where is the maximum contraction, like around 1 to 2 units. So it will release this and this eyebrow will go down. And this is a very important thing. With if the patient comes to you, see, they put me Botox and they made me this, how can you solve this? You solve it and he will become your patient, because he will never goes again to this guy, and he will be coming to you since that the other doctor made him a Mephisto. So it's very important to understand the relationship between, for a nice eyebrow to work on this muscle. This muscle lets the eyebrow go down, and this muscle lets the eyebrow go up. So if I make a balance between two of these, which I will be teaching you later, the eyebrow will have a nice flare. So for frontal area, this patient, I cannot inject Botox here. She has two frontalis, not a one frontalis. And as you see, she has this effect and this effect. This guy has a one frontalis. See, if you don't inject here in Botox, he will have here wrinkles and he will tell you, oh, what's that? So how we inject in the frontalis area, as book says, you have to inject in a zigzag or W, 2 units superficially. As you see, it's green. It's not yellow nor red. We want to relax the frontalis, not paralyze the frontalis. Since if I paralyze the frontalis, I will get my eyebrows go down a lot, since it's the only muscle who elevate the eyebrow. So this is why I want to relax him to eliminate wrinkles, but I want him to still elevate a bit of elevation to maintain static elevation of the brow. So less wrinkles, less buttocks. Also, do not inject in these areas for not having droopy skin upper the eyelids. That's why when I will be explaining you with my technique why you will never be injecting these. The book says for people who want to learn this, you see this picture and you don't understand why he's doing this. And you don't understand, okay, how I will be doing it in the patient. So I'll be explaining later how not to go with this. So for the frontal area, it's the only one which elevate. So as you could see, you have to not paralyze, you have to relax this muscle. For lateral canthal area, so as we know, the orbicalis muscle is the only muscle which makes these lines on the lateral side. So if you see it has medial, middle upper portion, depressed middle region of the eyebrow. So the upper portion approaches the eyebrow, the lateral portion depresses the tail of the eyebrow. So that's why when he does like this, as this patient is doing, the eyebrow will go down. So it's very important, as book says, you have to go minimally 1 centimeter from the orbital rim. Okay, so you inject. As you see, the muscle is a big muscle. It's not a small muscle. It's not a small circle. This muscle reaches till here down, and till here up, till the eyebrow, till up here. So this here there is orbicularis muscle. The orbicularis muscle is not like this as I'm drawing in here. It's more bigger than that. It goes from here to the eyebrow, upper the eyebrow, to the lateral part, and till here down. So it's a big muscle. So as you see, when I make like this, I will let my eyebrow, if I'm static, it will go up. So also books explain that you can inject, make a line, inject 1, 2, 3, 4 around the eye. It never goes up sometimes. Also you could wear an eyeglasses. Sometimes I wear so I can check here veins and not inject in a vein and not have a blue bruising. Or you can use the echo vein, where you could see the veins, and inject Botox when there is no veins. There is a lot of strategies for this. I know people who inject 2 units, 2 units, 2 units, or two. Some people inject 4, 2, 2, 2, 2, and another line, depending how much far you can go. I'll be explaining them my technique and understand, but see what they are doing and let you understand. Other type, you can try lower eyelid here. You can inject. This is I do it a lot. Only 1 unit in this muscle superficially, as you see it's green color. You can put 1 unit, and it relax and no wrinkles will be here. Sometimes this bulkiness you could inject 2 units. I do that sometimes in some patients who needs. This is, I called it extra Botox, which is I should charge more because this is not that typically the patient needs me to treat this area. I'll be treating him and putting 2 units. The bunny lines. So the bunny lines is a muscle. The nasal muscle has two portions, the transverse and the alar, and we have another muscle which is called the septal depressor muscles, which are the next to the rotator alar muscles, which is the depressed nasal tip. This is the septal depressor muscle, and this is the transverse nasal muscle. As you see, the nasalis muscle, the transverse one, and the descending, are the one who makes the bunny lines. So do not inject in here down, inject here up. So when I inject, I do not inject here, I inject here up. It will diffuses and it will reach till here. Remember that if you inject this muscle, you will have part of the gummy smile will not show. So that's why I do not inject for treating bunny lines. In here in the border, I go up a bit, I inject. So she will not have any bunny lines in this area. So I inject in here up, in here up. Sometimes you can put some also here if they have a lot of transverse. So you could do a lot of strategies, and I will be explaining later what's my strategy, but it's deep, it's red. For bunny lines, as you say, if you inject it, it's up, you leave two good lines. The nasal alley flare. So for the nasal alley flare, you can inject 2 units in here or 2 units in here and relax the muscle a bit. For it's not bunny lines, sorry, it's for gingiva or flaring. You could put 2 units half met, 2 units half met, and 4 units, and you will not have a gingiva show and not a lot of flaring. So for the gingiva, we have the orbicularis muscle, the lower lip depressor, the inferior angular depressant, and the platysma. Inferior angular placent, okay, the lower lip depressor, the orbicularis muscle, the green one, and the platysma muscle, the pink one. The depressant angular inferior, also called DAO or DAI, have both names. If I relax this muscle, this corner will go up. If I inject here Botox, this will go down and I will have a complication. So we don't want to inject here, we want to inject here. The platysma, we can inject it to not having lines in the platysma, and the orbicularis muscle is to we can inject in to not having these barcode signs in the mouth. So it's very important to understand how much gingiva smile you should show. This is normal or not normal, or you could tell me I don't know. So for women should have 2 millimeter show, which is the normal and nice show. For a man, this is the maximum for a woman. If a woman has 3 millimeters, she has gingival show. If she has 1 millimeter, she doesn't have gingival show. If she has 2 millimeters, she doesn't have. This is the maximum she could have. And this is the natural, nicer, good. For a man, should be 0 millimeters. Normally, men has -1 normally, or 0 or -2. And normally, woman has 0, 1 millimeter, a 2 millimeter, which is normal, nice mouth, gingival show. Whereas if she has more than that, she has a gingival show and she needs treatment with Botox. So if there is a woman who comes telling you that, oh, I have only 1 millimeter show or 2 millimeter show, tell her this is normal and this is the natural for a woman. You should not treat that. If she has 5 millimeter show, yes. And the 5 millimeter show we calculate from the teeth till here. In maximum smiling. I have seen some doctors injecting in here to relax a bit these muscles in a superficial way so it will go down. But in fact, I don't use this at all since in fact I prefer to do it in another way for gingival show. I'll explain later. So how I do for gingiva show, what I do is I inject in here in the middle so far, then I inject in here half mid like 2 to 4 units or 4 2 units. So what's the trick? The trick is start by 2 units, see how much it goes down. If it improves and this is the nice one, you can stop. If you see for next one you need more to decrease in here, you inject 4 4 two more units. I mean, you have the first 2 and then you can add 2 and you can add 2. As you could see also, you should see that if the patient has some more show in one area than one area, this means because the maxilla is not straight and she needs more Botox in this area, but never overcorrect. Start using same amount, let her come for a review, and you can add a bit more in here than here. This patient is only for showing. You can put between 2 to 4 units. Always use 2 and then go for more. This is my recommendation. And as you see, with 2 units, she get this. She needs a bit more here. I have reached her for maybe 1 millimeter show, or maybe here 0 millimeter show. So if you want this to be done, you need to be treated then in with some 2 units more Botox. So as you could see, in this patient, I put 2 units. She have been treated by another one. Sorry, case is not mine. It's a beware because I'm taking the picture and I'm telling you that maybe they injected 2 units here and 2 units here. It's from a book of complications, and no one would lie to have a long lip and unnatural smile in some people. So that's why I'm telling you start with low dose, then go for more. Maybe they put 4 units or 5 units and give this result. So, and I see this is a bad indication also. As you see, this patient, she didn't have any show, and maybe the doctor didn't understand that she wants less show, and he didn't let her know that women should have some show, and they give it to this result. This is a bad result. So perioral wrinkles, smoker's coat bar, you can inject 2 units. and you cannot have any complication. We must be conservative. It's ideally for these the best is fillers, but if we inject Botox, we get like a pro lifting effect since the lip it's not doesn't contract a lot, and you can have a nice views. You inject where are these lines, and you can inject how much? Two. I can go for maybe 12 units in here easily. So the corner of the mouth, the depressor angulis oris, the DAO muscle. Remember, it's the marionette lines which makes the muscle goes in like this, which has a lot of contraction. If you inject Botox, you release and you make a nicer effect. For it's very important to differentiate between the DAO and the inferior labia depressor, which if you inject in here, you make a complication. If you inject here, you give the good effect. So how we draw this and how we inject this, I make a line always drawing from here to here, where this boomerang reacts is where I inject in here, exactly in this boomerang, the 2-4 units. I always go a bit posteriorly and inject, let's say this is the middle, I go like in here, inject 2 to 4 units half midway. Depends how fat the one has, but you could go half midway between yellow, it's the yellow signs which I do, and you can inject 2 to 4 units. If you are somehow fear doing this because for not having any complication, go for superficial with 4 units, which it will diffuse a bit to the muscle and relax the muscle. But when you get expert in this, you will not have fear in it. So as you see, you can start with 2 units. If you inject in here, you will have a problem and you will get this complication. The mentalis muscle is the that as you see that you could inject in where the muscle is injecting, and you can release the muscle and improve this cobblestone appearance, and by this uh, do not have this like stony appearance in the chin. How you inject this? We can do that by putting 2 units and like this image, or without the center one, and always when you put this, never go so laterally because you can have the complication of the muscle, and this complication of the muscle you will have released, the mouth will react as a paralysis. So it's very important never to inject in this area, always in the center and in the lateral part of the down. Also inject for 3 centimeters of the lower lip for not affecting the orbicularis of the lip, and the lip will flip. So as you could see, I go so far on red for the mentalis. This is a case. As you see, we inject 2 units. You can also inject one in the center with 4 units. How much center you go, it's more safe. If you inject in the center 4 units, it will diffuses and will relax all the muscle. And is a suprachel intramuscular injection, ideally 4 points to avoid residual areas of stone, but if you have some fear, you can go one for the center. Platysma bands. So for bands, we draw these bands and we inject superficially. We don't want to inject so deep. We want to relax the platysma. Normally the platysma is so near the skin, except in fatty guys or fatty women. We normally use, we do not exceed 16 units. since we could have some aphasia and dysphagia or swelling muscle weakness if you inject somehow deep. So that's why it's green. So here is somehow, as you could see, is what I inject for my patients. And we will see some patients. As you could see, I can inject in the center here for Procerus, red. If you would like, take a copy of this image. Then I inject in here where the brow starts, red, for the corrugator. I inject in a yellow color over here for the other part of the corrugator. I inject the frontalis. I inject 4 points in here, one in the upper eyebrow, one here, one in the center, one lower a bit. I inject up here, it's more up, sorry for the image, it's more up, it's like more here, for the bunny lines. Here for the gingival show, as you can see, green, green, red. Red is so deep, green is superficial, and this is half midway. In the lips, here, in all the lips, in green. For the Dow, you can inject in here up or here. For the masseterous muscle, we will learn with a case. I inject red. For the mentalis, I inject red. For the Dow, as you could see, you can inject. And the green, you can inject for neck. We'll be seeing that. For the masseterous muscle, it's very important to inject how much posteriorly. Draw a line from the ear to here and draw the line of the masseterous. And when you inject, never inject in here. Go injecting in here and it will diffuses. Since so typical to inject in here, diffuses to the zygomatic and have a problem. As you could see, you could check all these 5 units, 5 units, 5 units, and it's around, I inject sometimes around 20 to 30 units, go more posteriorly, and try these injections go like this. As you see, these are some images. I'm injecting only when there's circles, although it's not the same in here, but go posteriorly since it diffuses a bit or diffuses to the zygomatic. So go this, you can inject more here, but not a lot into anterior. I had a complication of a patient which it diffused. I injected like in this area and diffused for the this muscle, and she has a like 3 weeks uh, small paralysis of the elevating of the mouth. You can only see it when she smiles. In fact, she came to the office very happy, but I detected it and tell her that this is small diffusion of complication. It will release in some weeks, and finally she released. And when the Botox finishes the effect, and she's very happy. But just beware because it happened to me. I'm explaining things which you could learn also. For Bell's paralysis, when someone has a paralysis in this area, you have to treat this area. Just you treat it as cosmetic procedure. You inject in the corrugator here, here, frontalis here, and this part. For fascial pain, also you can inject the temporalis muscle, about 20 units in every place. It's very simple. You make 4 or 5 points in the temporalis. You draw the temporalis from here. You inject 1, 2, 3, 4. Zero problems, zero complications. You have to inject so deep, depending also how much skin someone has and fat. But if someone clenches on his teeth, you can feel the muscle, and you can inject in and go for more in the hair. Depends how the muscles are. So for Frey syndrome, you could also, this patient presented after a fascial surgical procedure. If you don't know what's Frey syndrome, is they make a surgery and the synapses goes for the skin and starts sweating whenever he thinks in food or eat. So it's a complaint of sweating around the sideburn region when eating. So the starch iodine test is identified and of offending region. We put some starch, then iodine, and let him think in food. And by this we can treat the area which is stint intradermally superficial. So the way I do it, let's say that I want to work with Chomin, 100 units. In Arabic countries, it's very good to use Chomin, no need for refrigerators. And for Chomin, we have 50 units and 100 units. And as you could see, Chomin and Botox results are so similar. So for people who use Botox and want to try Chomin, you can use it. As you can see, no difference in peak effect. Also, the good thing of Chomin, it's the same dilution as Botox. I've told you if you have 50 units, we should put 1.5 milliliter of saline. If we have 100 units, we have to put 2.5 milliliter of saline. If we put 2.5 milliliter of saline, we have 1 millimeter, 2 millimeter, and half. If we put 50 units, we would have 1 millimeter and 0.25 millimeter, which is we have here. So every 1 millimeter is 4 units. If we do mathematical, if 50 units in 1.5, 1 millimeter would be 40 units. And we'll have 10 units in this. 40 plus 10 is 50 units. And here we'll have 140, another 140, and 20 units. This is how we know how much tonnage. So every 0.1 millimeter, 0.1 millimeter, 0.1, 0.1, 0.1, 0.1, we will have 4 units. So every 0.1 is one injection for the corrugator, let's say, at half this amount. So 0.05 is for the frontalis muscle, let's say. And why use 1 millimeter, not 0.5? Because it's so simple to release the injection from here to here, then from here to a bit. So this moving from here to here is so constant and so good. You can always use also Bocotour from Mertz, which no need for refrigerator, or Botox. So let's start my case. Let's say this is a case which I get, what I do, and how do I start the case. So this is a patient who comes and she needs Botox, which I do. I tell her, okay, I don't clean the face with alcohol. I just put some saline, clean by saline. Then I draw her when where she's maximum elevate his eyes, when not the pupil. When she maximum elevates this, I draw a line up. When she maximum elevates this, I draw a line up. I let her make the frontalis goes up, and I leave like 2 fingers from the eye. Draw a line. I start putting the procerus for units, the corrugator in the eyebrow, here where exactly the eyebrow is, and where the maximum eyebrow reaches, I put 4 units. Beware, half mid and go a bit up, since if you go in red here, it diffuses to the front to the elevator palpebralis, and you will have a ptosis. That's why we inject half mid yellow, half mid, not red, and mainly go depending where the muscle is. So what I do is also I put a point in here, like 5 millimeters from this line, 5 millimeters from this line. I put 2 units here, and then I draw where she has double frontalis. So I draw this. I should not put here buttocks. So I make like a W. Some people have big frontalis, so I make more W's. So very important things: lateral blue point. Avoid Mephisto sign, inverted V, brow shape. So if you draw this, you will never have a Mephisto sign, which we have been. You will not draw where is the maximum eyebrow. We draw where is the maximum brow elevation, the corner. It's making like here the corner. So which this is her maximum elevation. I draw a line. Frontalis zone, mark the triangle where there is no frontalis, make a W line. So, and start in 5 millimeters from this line, 5 millimeters from the line. In the line, inject 2 units. Green, all are green. So, horizontal line, 2 fingers distance from the brow. If you have 2 big finger distance, my hand is small hands, so it's like 7 for surgeons, 7 number glove. So if you have big fingers, it should be 1 finger as okay. So the corrugator, you inject in internal, in the internal one, deep injection in the head. If you need to inject 3 because she has a big corrugator, you could go half mid and more superficial. How much you go laterally, you go more superficial. As you see, I do not inject in this area. Remember that I told you do not inject here because you can have a droopy eye. So we do not inject this area, this area, this area, because I need a part like 1 centimeter of frontalis muscle to still active. This is a frontalis muscle. Here we're relaxing the frontalis. Here we're having like 1 centimeter of frontalis muscle working. So as you see, this is the maximum elevation when she elevates his eye. I tell her elevate your brow. When she elevates, I draw the line when she's maximum. 0.5 millimeter, 0.5 centimeters. I inject 2 units. So I'm doing now a strategy. What's the strategy? I'm injecting 4 units. Copy this, 4 units in the eyebrow, lateral eyebrow, and 2 units here. Why is this? Because I want to have a nice eyebrow shape here. If I inject 4 for the orbicularis, this eyebrow will go up. And if I inject 2, this eyebrow will go a bit down, leaving a nice aspect of the brow. So this is the trick. Inject 2 units here, 4 units here. And then you inject the typical for this. You can draw a line in the center, inject 2 units here, 2 units here, 2 units here. And sometimes I go for here, more superficial 2 units. Remember, if you go here half mid or deep, you could have affection of the zygomatic muscles and she could have paralysis of the eye, of the upper lip. So why you're going superficially? 1 to 2 millimeters injection. Also, if let's say by this you will never have a Mephisto, but let's say you made an error drawing this line and you went more centrally and you didn't put it where she's maximum elevating, you could put, she should come in 2 weeks and you can use 2 units in here, whereas the Mephisto is. So you can have a linear line, inject 2 units. And for the crossfit, use always 4, 2, 2, 2. This is a nice trick with 2 units here and 4 units here to have a very nice brow aspect. All your patient will love this. Let's say for marionette lines, I draw a line in here and where it makes the boomerang episode, I can inject 2 units or go more up and inject 2 units. How much up I go is more safer, but you can inject here 2 units in the boomerang, which is the most safest area. You can inject 2 units if you have fear of doing that. Don't worry, go for superficial one and you will relax it. And then for gingiva, you can inject 2 units here, 2 units here deep, and 2 units on the other side, and start with low. It's red. As you see here, we have the Dao muscle. This is where you inject the 2 units in the boomerang. As you see, here's the boomerang. Don't go medially in the boomerang. Go more posteriorly in the boomerang. Okay, and inject only in one place. If you inject down, you have more risks. Trick, inject below the corner. There's another area. I always used to inject in the boomerang and never had any complication. Trick, open this always to take all the Botox. Don't forget. You can buy one and you can inject. So by this patient, she doesn't have a big head, so I used around 40 units only for this. And this is not the correct treatment because you still have the bunny lines, you still have other things down part of the mouth. So if you want to treat all these things, address all these things, you need minimum 60 units to 70 units. This is another patient. Let's learn it again. As you see, she has a facial asymmetry and whatever. So I tell her, elevate your eyebrow Where maximum she elevates, I draw a line. Then I leave two fingers. I put in 0.5 centimeter, 0.5 centimeter, a point, a point here, a point here, a point. You can make W's. You can make straight lines. I prefer W's. I put 4 here, 2 units here, 2 units here, 2 units here. 4 units for the proceres, 4 units, 2 units, 2 units. So we'll be explaining. As you see, I put here 2 units for the bunny lines, 4 units for the proceres, 4 units in the eyebrow, 4 units more medially, and 4 units because she has a powerful corrugator in here. Remember, it's half midway because if you go so far in, you would have a complication. And then you could put 4 units in here and 2 units here to make the nice trick, and 2 units, 2 units, 2 units, 2 units, 2 units, and here, as I told you before, you put the line and you put these 2 units. This is the trick 4 2 2 2 with 2 units here to make a nice effect of double. For the neck, you can draw these. Sometimes you don't have hair lines, so you calculate and you put 2 2 2 2 units for treating. Never exceed 16 units. Do not inject in between, only in the bands. Another thing, for mandibular enhancement, you can inject 2 units here, 2 units here, and 2 units here. And by this, you could have a relaxation of these muscles and some pro effect. I do it in patients who come and tell me they want this, but not frequently. And so superficially. You draw the dow line and from here to back. Take always pictures, how they are. Explain facial asymmetries. Tell her that you have an eyebrow bigger than the eyebrow. This is a doctor which we made a course, and I draw with a black pen on here to let you see everything. So also let her in repose, take pictures in movement. And as you see in this patient, I will draw a line here and draw a line here. Its maximum elevation, is here. It's not half pupil. It's in here. It's in here. Okay. So I could draw the corrugator muscle. As you see, I could draw it in here with my mouse. The procerus muscle is in here. I could draw these lines if I want. She doesn't have any gingiva. I could draw these lines in here. I could put 4 here, 2 units here, 2 units here, 2 units here. 4, 2 units, 2 units, 2 units. 4 units here, 4 units here, 4 units here, 4 units here, and 4 units here. Yellow, yellow. These are red. Always, as you see, if you put the suctions in, you could draw here maximum elevation. You could draw the line which you will not inject Botox. You could draw it. There's the muscle she has, the powerful muscle she have here, less here. You could draw the line here. This is only for she's a doctor and she came with 2-3 doctors. They want to let me draw with black pen. I don't use black pen. I use Maybelline woman white pen to draw all these stuffs in the face, which is you can quickly erase. So I draw where she doesn't have frontalis muscle, and I put all these points and start. I will stop because you have learned. So after just I clean everything in this patient, I did also, as you see, I could go for the bunny lines. From here to here, it's 4 units, 0.1. So by this, I'm making 4 units. I could go also for in here. She has some like 1 unit and 1 unit here, 1 unit and 1 unit here, or put only 2 units in the center. 2 units it means like from here to here it's 4 units, from here to the center is 2 units. So for facial paralysis, it's very important. Let's say that this guy has a facial paralysis in this area, and this works very good. So what you do is this trick. You put the procerus here, the corrugator here, and the corrugator, so you can paralyze the corrugator, so no contraction in here because he has the paralysis, and no contraction here. For the frontalis, you draw the same line. You draw a line, you leave it 2.5 where it is maximum, and you put the W. You put 4 units, 2 units, 2 units, 2 units. Sorry, it's a 4 unit. I will correct this later. It's 4 units, 2 units, 2 units, 2 units, and 2 units here. I'll correct it. So again, as you see, what I do is you never ever inject the zygomatic, although he has powerful movement in here. But if you inject the zygomatic, he will be so sad. So you inject 5 units in here beside the nose, so deep. 5 units not in the DAO muscle, in the depressor labii inferior, in the muscle I want to make paralysis. Yes, this is the only case that you inject in the depressor labii inferioris to improve this when he smiles. So the only muscle you do not touch are the zygomatic muscles. Take picture of this because it's very important. So for post-injection, do not massage, do not make up for 2 hours, avoid sun, and avoid aggressive workout. She can move her head wherever she wants. As I seen the patient telling me, "Oh, the doctor told me that I cannot take something from the floor." Yes, you can take something. The important thing is do not massage and do not do sports, because if you massage, you're moving the depression, the diffusion. So also we do a lot of Botox for pre-surgical injection to eliminate the function of the depressor for a better readherence to the cranium when we do eyebrow elevation surgery. So when I do brow elevation surgery, I get the patient, tell them, okay, come to me. I will inject normal Botox and aesthetic Botox, sometimes between 15 25 units, sometimes 40 units in the frontalis muscle, the corrugators, to elevate all these contractions. So when I elevate, it will readhere in a nicer position without the affection of the muscles. This was described by Javidinia in 2013 when he did his endoscopic brow lift. So let's talk about Botox muscle paralysis. So it's very important the dosage, the volume, and the diffusion. And to understand how diffusion is important to avoid complication, when you inject in the corrugator, in the medial part of the corrugator, you can diffuse to the elevator palpebralis and have a complication of drop loss. This is a patient. Do not forget, when you do not you have to treat the upper part of the frontalis. Some people doesn't have here frontalis because it's two frontalis and there is a free triangle of muscle, but some patients has one frontalis muscle. So in these patients you have to make a W, go up, go down, go up, go down to relax the muscle. Although you will have the complication of these famous people who are in the TV, like Fox News TV, when the I start. For frontalis, do not inject all the muscle frontalis like this, patient, one here, one here, one, because you will have abroptosis and it will not elevate a lot. So that's is very important. Review your patients in 1 week always. If you do my trick, you will never have a Mephisto sign. This patient has a Mephisto sign here since they put Botox in half mid pupil, not in maximum elevation. Also, another complication of other patients, it can be avoided by drawing the andro, which it's my line. I call it the andro from my name. So if you do this, you will never have a Mephisto sign by drawing where is the maximum line elevation and draw a line in here and 0.5 you leave. Always draw your patients. It's not on I draw my patients. I take between 5 minutes to draw them, explain everything, and see what they need. Always inject, go far 10 millimeters from here. And although you're going 10 millimeters, if you go so deep, you can have a problem in here, apoptosis. So that's why this is half mid, so about 4 millimeters only going inside. We want to relax the muscle here, relax with somehow paralyzing here. We want to paralyze. Whenever you go medially, you have to go more superficially. So what I do is, in this case, let's say these points are not mine, these are of books. But if you see, I inject in 4 millimeter in here, and 4 millimeter in here, red, and 4 millimeter in here, yellow. Or alone 4 millimeter in here, red, and 4 millimeter here, yellow, to avoid any complication. I always inject the first one in the brow, and the other one is like 10 millimeters from the brow. Let's say that you got this complication of a patient with brow ptosis. So what you can do is use alpha 2 adrenergic agonistic, which causes molar muscle to contract quickly, elevating the upper eyelid about 1 to 3 millimeters. So it's used to treat glaucoma and Horner syndrome because of its effect to increase muscle tone and lower intraocular pressure. And the dosing for iopidine is 2 drops every 8 hours until ptosis resolves. It's applied to the affected eye only. So it's very important to tell the patient this is not God, that you will not have a better effect, but there is nothing to do except wait. But if you use this, you could have a bit of better effect, and depending how much ptosis you have, it works more. So this patient went to a doctor who had made this ptosis. Why? Because he injected 4 millimeters here deep and 4 millimeters here deep. You have to inject 4 millimeters here deep and 4 millimeters in here up, half midway. So no complication you can get. With this complication, you have to use this and wait. So for crow's feet, it's very important to go from the rim about 1 centimeter, 10 millimeters, and not inject in here, because you can have some problems in the eye and transfuse to the muscles of the eye. That's why you're injecting superficially. We want to relax. We don't want to paralyze. And for not going so diffusion, it's so near the muscle. The muscle is so near the skin, I mean. So we need by this to act here. So here, for avoiding having diplopia, we go 1 centimeter outside. Beware that this area could get a lot of bruising when you inject Botox, so use your loops or AccuVein to know where are the veins. If you don't have AccuVeins nor loops, just tell the patient that he may have some bruising in this area, because this is a sensible area. So for the zygoma, do not inject, never, never. And if you inject in here and you go a bit here for treating these lines, let's say that you want to treat these lines and you inject here, not superficially, you can diffuse a bit of Botox to the zygoma and have this effect of paralysis. So beware for patient who has a lot of here. This could be treating by peelings, by other stuff. Don't go for Botox. You could have patients with facial paralysis and no one loves this, and you have to wait for 3 months. And there is no solution for correcting this. No solution at all, except to wait. For people, maybe sometimes you inject Botox here and you don't inject in the center, and you can have a buckle in the center. So you have to put some Botox in the center and release the muscle. You can put 2 units here, 2 units here, or try in another way. In this patient, they put 2 units here, 2 units here, and they avoided to put 2 units here, and it contracted the muscle. So you could put 2 units in the center here and 2 units in the center there. Or 1 unit and 1 unit. Start always with complication with less units and go for more, because people who have complication are so unhappy with the result. So start with low dose. Again, it's very important to check the case. Then see in here where is the dow muscle. There are a lot of studies to avoid injecting where is the safest side in the dow. And as you see, if you inject in here where there's 30 degrees, the other muscle is below. So that's why when you inject this, you have to go half midway, never deep, because let's say that by error you injected in here in the middle, and you went so far in, you could inject the depressor labial inferior and you could have a complication. So that's why the boomerang is here, and I go a bit posteriorly. And you can read this article published in 2014 about anatomical consideration regarding the location and boundaries of the depressor angular oris muscle with reference to botulinum toxin injection. This is published by Choi in 2014 in the Plastic Reconstruction Surgery in November. So as you could see, you could read it and you can understand that this is the safe area when you inject, as I explained earlier. So if not, you could have a paralysis, and no one wants this in his case. So the trick is where she has the boomerang in here, just inject 2 units and 2 units, and she will have a nicer effect. Again, for central chin in people who have this, it's so typical for all patients who does chin surgery, surgical sutures like genioplasty of advancement. They will have this stone effect here. You can inject in them Botox, or you put 10 units in the center, or 5, or you put 2, 2, 2, 2, and 4 units. There are many types. People put 10. I like to put 4 units, 4 units, 4 units, 4 units. Some people put 10 in the center. Some people put 5 units and leave it to diffusion. Some people put 2, 2, 2, 2, and 4 units in the center. It depends on you, but always go for the center. Never go laterally and so deep. You have to go reach exactly the bone. If you cannot, if you don't go 3 centimeter far from the lip, when she makes like this, the lip will go in because she doesn't have power in the lip. This is a diffusion of muscle of Botox, which is a complication and an error of a doctor who did this. So for the platysma band, it's very important to inject in the platysma. And when you inject, you have to see that only inject in the lines, never in between, and do not exceed 16 units. Pinch up the muscle and inject superficially. We want to relax this muscle. If the patient has a lot of fat, you have to go a bit deeper. But normally the patient who comes for that are women who are old women and want to correct these lines. So it's very important to do correct Botox. So this patient is unacceptable. I don't know. She's a very important person in the United States. Putting Botox, she has put in the corrugator. She doesn't put in the frontalis. Do not accept people treating you by an area. Only doctor, I won't hear Botox. Only doctor, I won't hear Botox, because the result could be somehow fake. Let them know these things. Let them see pictures and they will understand. So don't try to sell using to help them in an area they want. Also for pregnant women, can I inject Botox? So as you could see, it's ordinarily incapable of crossing the blood-brain barrier, the Botox, and generally exhibits no systematic effect. But as you could see, pregnancy is, according to the FDA, it's rated as class C, which means that it was not researched on humans, however was researched on lab animals and resulted in a low birth weight and debilitation. So I wouldn't do that, as I see no urgency of such a procedure during pregnancy. You can receive treatment after the pregnancy and when you are no longer breastfeeding. So although there is no studies that says that is this, and it's FDA rated as class C, do not use Botox on pregnant women nor breastfeeding, although it's a local effect. So resistant to Botox, what do you know about that? Yes, there is resistance to Botox is rare and has been reported with repeated largest dose of endotoxin. Also remember that never let patients do their Botox before 2 months. Let them wait 3 to 4 months. Tell them that you are helping them and not rejecting them of doing the procedure. Helping them is helping not to have resistance in the future. So they will understand this and will not go to another surgeon telling them, oh, that he doesn't want to make my Botox, I will go for another one who will make my Botox. It's very important to be with your patient as a coach, to help him understand things, and he will decide to be you. You'll be your surgeon or your doctor. Do not inject in last time, as I told you, and resistance from prolonged usage of strabismus treatment appears to increase with the use of more than 300 units within a 30-day period. So beware also of illegal Botox. There is online a lot. They are the same aspect of legal Botox from non-illegal Botox. There is illegal Juvederms. There is a lot of things which are illegal. Beware of them, and mainly in countries which are uh, not the European or the United States countries, and where there is less governmental follow up of these things. And you could see some announcements like this in internet or in papers about that one vial costs like that and two vials of 500 units cost like that. So beware of these things and take care. I got a lot of emails from Chinese from everywhere, mainly with Chinese names. They are not from China, maybe, but they are Chinese names. They write you by these special offers. Beware of them. Also, this is a medical newspaper from Spain telling that everyone who should do a cosmetic surgery should pass a psychological test, and it's part of the Lex Artis. So I know that a lot of us doesn't do that, nor work with a psychiatrist or psychologist in his office, nor send for that. But it's very important to have a small evaluation at your office so you could exactly grade this and always be defended by law. Also, there's another newspaper telling that one lawyer made they lost one doctor lost his in the court because he didn't make any psychological study before doing her the cosmetic surgery. So some cases it's very important to see how when she contracts she doesn't have. I know that you know about Botox and to understand about cases, but as you could see the effect of Botox, how it releases. If you want to treat this, these are static wrinkles. You need to put some fillers inside, like soft Belotero could be a good one for these. Also, you could see how contraction is. How you really, if you want to improve this, you need peelings. Okay, you need peelings here. If you want to improve this, these are static ones. I improved it. She's trying to give a kiss, but she cannot because she's relaxed. But you want to improve this, the patient comes, oh, my buttocks didn't work. This is not the effect, but this you need to be filled. The mysterious how much powerful it is. You can inject 30 units and relax it a bit. Here, 10 to 20 units, you can relax it. See, sometimes you should draw the lines. She doesn't have here muscle. Don't inject Botox here. Only inject where the muscle is. And as a conclusion, Botox is an effective treatment to treat dynamic wrinkles of the face. You should use the most appropriate type of toxin for each patient at doses indicated. Also, another conclusion that we know the fashion of it through before treating a patient. It's very important to know muscles, the deep how are muscles, and the amount. That's why in my keynote lecture, I want to let you understand how far you could go with a needle. It's green, yellow, red, or from are the things you can avoid to have complication like the Mephisto complication or the ptosis of the eyelid or the ptosis of the lip by reaching the zygomatic. Always inform the patient of everything and about complication. let him always sign the consent. We must consider the limitation also of Botox in areas which are static, and let the patient know before you do this treatment, because if not, you will get some people who are not happy telling you that you didn't solve these wrinkles.